So now we're kind of going to shift into looking at some practical things that can support and help you in your role in caregiving. And one of the things is really knowing, as you're a patient of the James, is knowing who your treatment team is. There are so many folks involved in your care and some behind the scenes. It's important to know who everybody is so that you really know how to navigate your questions and your concerns too. Oftentimes I hear people tell me down the road, like, wow, I didn't even know this existed until, we finished treatment. And I think, well, okay, so we need to back up a minute and really familiarize ourselves with who is a part of our team and what services are available to you here at the James. You, as a part of your team, there's probably going to be most of these people, and you may interact with them at different times throughout your care. Obviously, there are your physicians, your oncologist, your surgeon, your radiologist, depending on your type of cancer, and also depending on other medical issues that you may have. There may be other physicians as well involved in your care. Physicians' assistants and nurse practitioners, these folks work very closely with your primary oncologist, and oftentimes you may see them at the same time that you see your physician or in place of your physician. They communicate very closely with your oncologist and provide a large bulk of care. And also there's nurses. Nurses, it's very important to know who your nurses are because they are usually the ones who are triaging your questions and your concerns. So when you're calling in and you have a question about a medication or you're reporting a symptom that is problematic, the nurse is going to be the person who's taking that call and communicating that question or that need with your team. So becoming familiar with who those folks are is important. And they're really good at doing that, at being an active part of your care and providing you with that information. Some folks also may encounter a patient care resource manager. Those are nurses who specifically work with patients who have some complex medical needs. So if you are caring for somebody who needs some additional support at home, maybe they need home care or some medical equipment, or just kind of triaging different types of care, chances are a patient care resource manager is going to be the person arranging that and reaching out to you. Dieticians are a large part of treatment at the James. There are so many changes to diet and to your ability to eat and what you can eat throughout the cancer journey. And so our dietitians here specialize in oncology and are available for individual appointments and assessments and recommendations for you as well. And social workers are a pretty crucial part of the team as well. And you may not have seen one yet, but every disease line has a social worker, inpatient and outpatient. And so the social workers are available to provide you a range of support. Maybe it's providing some additional emotional support. Maybe it's linkage to some community resources, helping with some financial needs or some transportation needs. The chances are if you're having a problem and you're really not sure what to do about it, ask to talk to the outpatient social worker because if they can't help you, they can likely find out who can. So they're a good person to know that exists. And there's clinical pharmacists all throughout the James. And it's also, if you've got complex medications, they are someone who can provide information on your medications and drug interactions and your treatment. So they're oftentimes behind the scenes, but they're available to you if you have specific questions about your treatments or medication. And of course, there's rehabilitation. At any time throughout your care or treatment journey, there may be a time when the person you're caring for needs some physical therapy. Maybe they need home physical therapy, outpatient, or maybe it's a rehab facility. But this is a big part of care. And physical therapists, occupational therapists, and speech therapists exist to provide that assessment and recommendation for what you may need. These are some of the additional departments that are available to you at the James. And these are ones that I oftentimes hear like, oh, I didn't know about those things. Well, we're going to talk about them. A referral is needed for all of these services, but we have a survivorship clinic. As a cancer, when you're diagnosed with cancer, you remain a survivor at the time of diagnosis all throughout your life. And so this clinic specifically addresses the needs that cancer survivors have. It looks at patients from a whole person-centered perspective. So it's not looking at specifically the treatments that you're getting, but maybe all of the other things that you're experiencing as a result of going through treatments. Maybe it's, you need some physical therapy. Maybe it's that you need some emotional support. In this clinic, there's massage therapy, there are dietitians, a social worker to work with you, and there's a nurse practitioner who's doing those assessments and making recommendations appropriately. There's also the Palliative Care Clinic. And I think this one gets confused sometimes with hospice because you think of palliative and hospice and comfort care as the same thing. It's not. The main difference is that palliative care is a type of service that you can access at any point in the cancer journey. It is focused on experts in symptom management, and it's looking at the things that you may be experiencing as a result of your cancer treatments, or maybe just the type of cancer that you have, and really focused on alleviating the burden of some of those symptoms that you may be experiencing. And so Palliative Care Clinic is a great resource if you're having some distressing physical symptoms. And Psychosocial Oncology, we talked a little bit about that. Again, it's the department that provides counseling and psychotherapy to cancer patients and their families. And so if you feel like you could benefit from some additional professional help and support, certainly talk with your team, and a referral can be made for that as well. There's also art and music therapy. I didn't mention that they are a part of Survivorship Clinic, but they are. So art and music therapy are services that are provided inpatient as well as outpatient through the Survivorship Clinic. And art therapy, you don't have to be artistic to engage in it or to, feel like you have to be, artistically inclined. It's really another way to process and express the impact that cancer is having on your life. And some people really respond really well to that type of expression as opposed to kind of just talk therapy and getting that support. Music therapy also assists with that emotional coping, but in addition can also help with some physical symptoms. There are interventions geared toward symptoms like sleep problems or neuropathy or pain. So we have a skilled music therapist who can work with you on an outpatient level and inpatient if you're there with some of those things. And we also have a chaplaincy department. So when we talked about spirituality being a big component of coping and nurturing, or if you're struggling with that, our chaplaincy department is full of trained chaplains who can provide some support and some guidance and listening ear to help you kind of nurture and work through some of those larger questions that you may be facing. And there's JamesCare for Life. Hopefully all of you are familiar with JamesCare for Life since you're here today. But pay attention. Those classes and support programs change every quarter. And there are educational programs and mind, body, and spirit programs. There are support groups available through JamesCare for Life, and nutrition programs and exercise programs. And these are things that are free and that are open to anybody, to cancer patients and their families. There's also specific family programs, geared towards families with children. And so I encourage you to continue to utilize JamesCare for Life as well. There's James Financial Counselors. We talked a lot about how insurance questions can be very overwhelming. Debt, how often does illness create overwhelming amounts of financial problems and debt? And our James Financial Counselors exist to help guide you through maybe understanding your insurance plan, your benefits. Also, they help with recognizing financial need and maybe linking you with some resources to help with that need, and help you apply for benefits for the underinsured or uninsured. So they're available to you, and you can call them directly, or you can also have a social worker kind of guide you through that process as well. We also have a patient education department, and this department is really responsible for putting out information, resources, and educational videos that are easy to understand about many different topics that you may encounter throughout the cancer journey. So on that website, you can pull up their website and you can just search by topic. You can just browse what's going on, what all they have on there, but they have their wealth of information that I would encourage you to check out as well.